Sung, where clinical excellence meets excellent results. Today we're going to talk about the 5 conditions that really destroy someone's health. But these 5 conditions are the same priorities that we look for when a patient comes in and we're trying to help them. So we need to fix these 5 conditions or correct these 5 priorities in order for a patient to heal. Oftentimes patients come in and they're chronically sick and they don't understand why. So our job is to find out the underlying mechanisms. So let's get into the 5 reasons why your health may be deteriorating and not getting better. So let's get right into it. Number 1, autoimmune disease. What is autoimmune disease? It's when your immune system attacks your own tissues, much like Hashimoto's thyroiditis, rheumatoid arthritis, lupus, psoriasis, right? These are all conditions that attack the tissues of our body. So autoimmune disease will always create issues with inflammatory processes. And you'll never feel better even with medications because your tissues are always attacking, right? Your immune system is always attacking the tissues of our body. So if we want to address autoimmune disease, you want to remove the factors that create or inflame the immune response. So for example, food or food proteins. Things like Hashimoto's thyroiditis can be impacted by gluten, a food protein that looks very similar to your thyroid gland, and it creates molecular mimicry, and it creates an autoimmune attack on the thyroid. So removing triggers is very important for autoimmune disease, and food proteins are one of them. So gluten, dairy, sometimes all grains, nightshades, lectins, soy. Those are all the different common food proteins. Also, it can be related to stress or hormonal fluctuations. So those things have to be managed. Some of the best supplements when you do have autoimmune disease are things like glutathione or NAC or N-acetylcysteine, essential fatty oils, okay? Also, vitamin D is crucial for autoimmune disease. So having those types of basic supplementation is necessary when we want to help correct or modulate autoimmune disease. Number 2 is blood sugar dysregulation. Do we have low blood sugar? Do we have high blood sugar? The clinical signs and symptoms are very different. When you have low blood sugar, you can become what we call hangry, hungry and angry. You can have low energy. You can feel shaky or inward trembling. So that's when your blood sugar will drop. Soon as you eat, you feel better. Your brain fog clears. You get less shaky. That's a classic sign of hypoglycemia. Also with hypoglycemia, what you're going to notice is when you go to bed around 2 or 3 in the morning, you may wake up wide awake and can't go back to sleep. And the reason is it affects cortisol. So when your blood sugar drops, cortisol needs to be released to produce more glucose from your liver, and cortisol will go up. When the cortisol goes up, it will wake you up in the middle of the night. So that's why when we talk about sugar dysregulation, we also talk about adrenal dysfunction, okay? In the case of high blood sugar or insulin resistant or diabetes, oftentimes these are the patients who will have a big meal at dinner time, sit down on the couch, and about 5 minutes later, they're sleeping. They fall asleep. They can't process all that sugar. Okay. They also have a difficulty falling asleep at night. So they'll doze for 5-10 minutes on the couch, they go to bed, and they're wide awake. They're also the people who have that lunch and then they come back, sitting at the office, sitting in front of their computer, and they're nodding off. So sugar dysregulation is very important for modulating chronic disease. Okay, so you have to monitor that. So the best diets are typically things that are low in carbohydrates, right? Sometimes people are following the trend of using what they call carnivore diets, what you really think about is carnivore diets. It just eliminates all those inflammatory foods. So sometimes it'll help with blood sugar as well as autoimmune disease. Just having a strict carnivore diet has some problems to it, but that is the reason why when you do a carnivore diet, you notice relief from chronic disease. It's just because you're removing a lot of the inflammatory food proteins from our diet. Anemia. You need to find anemia. If someone can't get enough blood flow to their peripheral tissues, to their brains, they can't heal because they're chronically sick. They're not getting enough oxygenation and nutrition to the peripheries and to the brain when you have anemia. Types of anemia: iron deficiency anemia, right? When you have low ferritin and total iron binding capacity is impacted. There's something called megaloblastic anemia, right? When you have deficiencies in B12 and B9. There's something called pernicious anemia, which is an autoimmune condition related to B vitamin absorption, right? So they look for intrinsic factor antibodies for anemia. You can have anemia of chronic disease, okay? So you need to figure out what the mechanism for the anemia is and correct that. Digestive dysfunction. Oh, there's so many, right? There's H. pylori infections, reflux disease, Barrett's esophagus, SIBO, or small intestinal bacterial overgrowth. There's Crohn's disease. There's inflammatory bowel disease. There's so many different digestive disorders. But if you look at some of them are autoimmune. So you need to correct that. Also, if you have SIBO, or small intestinal bacterial overgrowth, you need to kind of manage that, because if you don't, you're going to get malabsorption issues and nutrient deficiencies. So digestive dysfunction is huge because you need nutrients in our body. Okay. Number 5, often missed, is stealth infections. So what are stealth infections? Sometimes you can have Lyme disease or co-infection of Lyme's and you don't really know what happened or how you got it. You can get things like Bartonella, Babesia, mycoplasma. So you can have stealth infections. Things like mold or mold toxicity can be also an issue. You can have GI parasites that you don't realize you have. You have all this bloating issues and they say, oh, you have IBS. But sometimes you can have an infection. I just recently had a young lady who had infection in her GI tract causing a lot of bloating. So stealth infections, you really need to go deep in order to figure out what the stealth infections are. There's testing available to figure these things out. But clinically speaking, all these things, these 5 things, really does a number on your health. But if you can correct these 5 things, your health will improve, right? So it's a strategy that we use in our office. We want to manage or categorize patients to a point where we say, okay, we need to address this condition and we need to manage this portion of their condition for them to get better. Some people, it could just be as simple as managing blood sugar to handle anxiety for them, all right? So it's very important to kind of pinpoint what you need to do or what you need to do in order to help yourself recover from chronic health issues. All right, my name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.